My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahaminous. So I'm doing a reaction video to a clip I saw about Dr. Dre. I thought it was an interesting video specifically because it discusses his response to trauma. So in this video, I'm going to talk about that. I'll show you the clip. We're going to discuss whether this is just a natural psychological response or whether it might be a mental illness like post-traumatic stress disorder. I'm going to tell you how I would assess and possibly treat Dr. Dre if I was his psychiatrist. I've dealt with several hundred cases of trauma and depression. I'm going to tell you what I think is my favorite Dr. Dre tune, and I'm also going to give you a little Easter egg, a little kind of quiz for you hip-hop heads from the golden era back then. But before we do anything, let's just get straight to the video.
Hey, what do you remember the most about The Chronic? Now, The Chronic, we say classic.
That's one of those records that I don't even listen to anymore.
Really?
Yeah, I just don't really like being taken back to that era.
I hear you.
You know what I mean? You know, it was right after my separation with Ruthless, and I was in survival mode. Going from that to the organization that I went to, you know, and all the things that were happening in the studio during the making, it was crazy. During that process, my house burned down. I was shot in the legs. You know what I mean? And I was in the studio on crutches for a couple of weeks. You know, so it was a lot that went into that record.
Dr. Dre, what do you remember the most?
Be quiet. Okay. So there's a lot to unpack there. There's a lot of different traumas, and I'm going to discuss most of those things. So as a quick context, as a psychiatrist, I've assessed lots of patients with post-traumatic stress disorder. So this is something I might diagnose. Also, I do civil court cases. So there's somebody that I've seen recently, for example, who saw the dead body of her son after a massive car crash, and that resulted in post-traumatic stress disorder. I diagnosed it, etc., etc. So I'm just giving you context of what I can see about Dr. Dre's report, which might be relevant. I'm also a hip-hop fan, especially of the 1990s, 2000s. I'm one of these old fuddy-duddy guys that talks about the golden era of hip-hop, and Dre is very much a part of that golden era. Right, let's unpack some of what Dre was talking about. So he was talking about what was going on in the studio, and if you're a fan of that era, I'm sure you'll know, especially if you've seen Straight Outta Compton, that there was a lot of issues, a lot of turmoil when he was on death row. Suge Knight was a really sort of aggressive person. He wasn't really clicking with Dr. Dre. There was like torturing of people beyond going on in the studio whilst Dre was trying to make music. Now I know Straight Outta Compton is a fictionalized version of that, but watered down version of those things did happen. When Dr. Dre wanted to leave, Suge Knight sort of threatened him. He actually beat up Eazy-E, but that's a whole other story. So we've got the Dr. Dre was witnessing all of this violence in the studio, which must have been distressing because he just wanted to get on making music. What other traumas did he describe? He said that there was a fire in his house. So I've done a bit of research that happened in June 1992 in his LA home. In all the articles I've read, it doesn't mention whether he was at home at the time. I'm assuming he's not, because that would be in the articles, presumably, if it was a newsworthy item, if he almost lost his life. Why am I mentioning this? Because for something like PTSD, post-traumatic stress disorder, by definition, there has to be some sort of life-threatening trauma. It has to be something that most people would find extremely, extremely distressing. So either being kidnapped, almost being killed, being sexually assaulted, something like that. So there's all of those things. He did actually say that he was shot in the leg, which I think is fair to say could have been a life-threatening situation that most people would be scared of. As you probably know, Dr. Dre has had other kind of traumas in his life. So for example, his son, Andre Young Jr., died of an overdose at the age of 20, but that was in August 2008. And the period that he's talking about when The Chronic was released was 2001. So presumably he's not talking about that when he's discussing these particular traumas. So I suppose what I'm saying is I think he's had a lot of issues and difficult times, but very few of them I would say would be considered life-threatening. And this is relevant to see whether there might be a diagnosis of post-traumatic stress disorder. Okay, very briefly, I'm not going to make this too sort of boring, dull, scientific, psychiatric jargon, but very briefly, post-traumatic stress disorder is a reaction to a life-threatening incident. The symptoms are reliving that trauma, in the sense of in the form of flashbacks. So that's like visually or auditory, like reliving, actually living back in the moment, or nightmares. There's hypervigilance, which means always being anxious, always being on guard. There's avoidance behavior, which could be relevant to what Dr. Dre's saying. So you avoid triggers that remind you of the original trauma. So, for example, I mentioned before, for a reason, that I recently assessed for a civil court a woman who saw the dead body of her son. She had PTSD from that, and she actually actively avoided the route where the road where it occurred. She actively avoided going into her son's bedroom after he passed away. Now, I don't think this is what Dr. Dre is talking about, because he's not avoiding the specific traumas. He's just avoiding listening to the chronic because that reminds him of that whole general period of time. So for that reason, I don't think this is avoidance triggers that you'd find in post-traumatic stress disorder. And also what Dre is describing, I think, are more intrusive memories. So they're uncomfortable, intrusive memories around that whole period of time, not actual flashbacks of the incident. So not actual flashbacks of the fire, which I don't think he witnessed, not actual flashbacks of being shot in the leg, at least not from this particular clip. So when I put all of those things together, I do not think that Dr. Dre was talking about what we would consider to be post-traumatic stress disorder. I think it was just a natural response to trauma that he was going through. And I think the chronic reminds him of that period of time, and he's just avoiding it. It's not related to mental illness. So if I was assessing him from that clip, I would come up with no diagnosis. Okay, but here's a theoretical question. What if Dr. Dre presented himself? What if he became my patient? What would I do? How would I assess him? How would I treat him? First of all, I'd be pretty starstruck. I'd probably get him to sign most of my things. I might try and shop him a demo tape. After that has all failed, I would flesh out his symptomatology. So I'm making big presumptions here, and I'm speculating, saying that he didn't have flashbacks, saying that he doesn't have hypervigilance. Something else that I missed out was emotional numbing that comes with PTSD. I'm assuming he doesn't have that because he's functioning so well, but if I was assessing him, I'd ask him specifically about those experiences so I could rule out post-traumatic stress disorder. Now, I briefly mentioned functioning. That is really important. So all of what I'm talking about is only really relevant if it affects one's functioning, if it affects Dre's functioning. So another way of saying that is more important than distinguishing whether he's got just normal trauma response or actual PTSD, I think, is deciding whether it's affecting his day-to-day functioning. And I think clearly it hasn't. I mean, the dude is really, really successful. In 2014, Apple acquired Beats headphones for $3 billion. Dr. Dre is worth $500 million. Dre, just from that deal, got $750 million. So financially, I think he's doing pretty well, I think is fair to say. He's still released a lot of music, still produces. So what I'm saying is there's no issue in functioning. So I don't know if he really needs that much treatment. But if he really wanted treatment because of the traumatic time period and to kind of process it, I would suggest something like cognitive behavioral therapy, specifically trauma-focused cognitive behavioral therapy. I think he's probably on the mild end of the spectrum. So I'd probably suggest 8 to 10 sessions, not lots of sessions, not, for several years like people with PTSD might have. EMDR, eye movement desensitization and reprocessing. I won't get into what that is now, but if you want to look it up, it's something specifically for PTSD. I don't think Dre would need that. What I might do for him is graded exposure therapy. So that's technically, or usually I should say, used for phobia. So somebody's got fear of something, you expose them to what they're fearful about in small increments to help them get over it. So for example, if I'm talking about this poor lady who was avoiding traveling down the road where her son lost his life, I would get her to think about that road. I would get her to drive near that road and drive back. Then as she becomes used to these things, whilst working on relaxation techniques and calming down and getting past the adrenaline response, I would get her to incrementally expose herself more. So for Dr. Dre, I would get him to listen to the chronic, actually, maybe in small doses and then increase it gradually and gradually help him process the trauma that he was exposed to around that period of time in his liggity life. Okay, as promised, I'm going to change tact and I'm going to talk about, in my opinion, Dr. Dre's best work, his best track. I mean, I actually think Dre is a amazing producer, probably top 10 in my opinion. People like DJ Premier, or Premier, I suppose we call him here, the RZA. Dre's of that caliber. I don't think he's that good a rapper, if I'm being honest. I don't think he's bad, but I think he's a bit mediocre. I think the best art he's ever produced, apart from producing Eminem, would be Doggy Style, the album. He did that whole album with Snoop, aka Snoop Doggy Dogg back then, although he's dropped the doggy bit of his name, perhaps sensing that his name is 2K9. In terms of the best tune that Dre raps on, I think it would have to be Forgot About Dre. Although, to be fair, I think that's more because of Eminem's verse than it is because of Dre's verse. So what do you say to somebody you hate? Anybody trying to bring trouble your way? Want to resolve things? Sorry. In terms of the best Dre tune that he just raps himself, I'd have to go The Watcher, I think. Everywhere that I go, I got people I know who got people they... Sorry. So, my Psych for Soul guys and gals, what do you think of what I just said? Am I correct? Do you agree? Are there better tunes, beats made by Dr. Dre? Do you agree with my analysis of his trauma? Let me know your thoughts in the schmomments schmection below. And also let me know if there's any videos that you want me to comment on related to mental health, possibly related to hip hop. Before I go, one final thing, a little Easter egg, a little quiz, let's put it that way, for any of you hip hop fans from that era. I'm going to rap some lyrics and I want you to tell me in the comment section who the artist is and what the song is. Don't look it up. Don't cheat. Don't Google it. This is for your actual hip hop heads. So here we go. Who's the suspicious character strapped with the sounds profound, similar to rounds spit by derringers? You're in the terror dome, like my man Chuck D said, it's time to dethrone you clones and all you knuckleheads, cause MCs have used up extended warranties, while real MCs and DJs are a minority. But right about now I use my authority, cause I'm like the wizard and you look lost like Dorothy. Don't harbor me, sorry. Okay, so let me know in the comment section whether you got that tune, and have a blessed day, and do not forget, I love you.